meeting on September the 22nd, 2021. Due to the COVID-19 pandemic, Regional Council is practicing physical distancing. I am in the council chambers with Councillor Jowett. Everyone else is joining electronically. I'd now ask the clerk to do the roll call.
Thanks, Chair. Chair Redmond.
Present.
Councillor Armstrong.
Present.
Councillor Clark. Councillor Erb.
Present.
Councillor Foxton.
Present.
Councillor Galloway.
Present.
Councillor Harris. Councillor Jaworski.
Here.
Councillor Jowett.
Present.
Councillor Kiefer.
Present.
Councillor Laurent sends his regrets. Councillor McGarry.
Present.
Councillor Nowak.
Present.
Councillor Shantz.
Present.
Councillor Strickland.
Here.
Councillor Verbanovic.
Present.
Thanks, Chair.
Thank you, Will. I'd like to acknowledge that the land on which we gather virtually today is the traditional territory of the Haudenosaunee, the Anishinaabe, and the Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions to our community. I'll now entertain a motion to reconvene in open session. Moved by Councillor Foxton, seconded by Councillor Jowett. Please use your icons to vote yes and no. That is carried. Colleagues, we are now reconvened in the Board of Health. Are there any declarations of pecuniary interest under the Conflict of Interest Act? Seeing none, and there are no delegations. Before I introduce Dr. Wang and Vicki Murray for their updates, I want to acknowledge the incredible work of the Vaccine Task Force and their respective teams over the past months. The coordinated, community-led approach has allowed our region to be a leader in the adoption of vaccine. Due to a steady supply of vaccine and a sustainable vaccine system in place, the vaccine rollout is moving to a maintenance phase, and the work of the task force is drawing to a close. I'd like to specifically recognize the work of Deputy Chief Shirley Hilton. Deputy Hilton has been an effective and collaborative leader. I think I speak on behalf of Council and the entire region in thanking her and the rest of the task force for their work. We're grateful that Vicki Murray will continue her leadership role in the vaccine rollout as we reopen and the pandemic continues to evolve. So, Deputy Hilton, I know you don't like being made a fuss over, but you have been absolutely amazing. So thank you for everything you've done, your leadership, and those lonely, hard decisions that you've had to make over time. I will now turn to Dr. Wang for a COVID-19 update. Welcome, Dr. Wang.
Thank you, Chair Redmond. Good evening, councillors. So Kathy Brosh will project my slides. If you could go to the next slide, please. So I'll start with my key messages. So one, the cases in Waterloo region and Ontario remain fairly stable at this time. Two, public health is supporting schools as in-person learning has resumed. And three, more than 14,000 doses have been administered at local schools, either through pop-up clinics or the mobile bus. Next slide, please. Regarding current trends, in general, case rates across Ontario have stabilized after increases in August. In Waterloo region, our case rates remain stable at this time. Hospitalizations and outbreaks are also relatively stable, although hospitals remain very busy, as they have many non-COVID needs to address, in addition to caring for patients hospitalized with COVID-19. Most cases of COVID-19 continue to be in individuals who are unvaccinated, and the risk of hospitalization is over 20 times greater, and the risk of ICU admission is over 40 times greater in unvaccinated compared to fully vaccinated individuals. Next slide, please. With the return of in-person learning, public health continues to support our local schools and school boards. In Ontario, the operational guidance for schools is set by the Ministry of Education in consultation with the Ministry of Health. The role of local public health units includes supporting school boards in the implementation of the Ministry of Education guidance, case and contact management, and outbreak assessment and management. The guidance provided to schools is designed to limit and control the spread of COVID-19 within the school setting. Next slide, please. Public health monitors all cases and provides guidance on testing and isolation requirements for the high-risk contacts of each case. An outbreak is declared when there are 2 or more confirmed cases of COVID-19 with an epidemiological link within a 14-day period, where at least 1 case could have reasonably acquired their infection in the school setting. Due to changes in the ministry guidance for the 21 and 22 school year, which allows for a student to be part of multiple cohorts, as expected, we are seeing an increase in the number of contacts managed per case. The team is monitoring approximately double the number of contacts for each case. Next slide, please. When an outbreak is declared, it is reported on our dashboard, which is updated daily at 1:30 p.m. Public Health continues to provide guidance on testing and isolation requirements for all cases and contacts and supports the school boards with guidance on outbreak measures. Public Health may also conduct on-site investigations as needed. Public Health will declare the outbreak over when at least 14 days have passed with no evidence of ongoing transmission. Next slide, please. This will be the last slide. Regarding the school vaccination clinics, we have a strong partnership with our local school boards and have been able to work together with the boards to offer vaccine clinics for students and families. We operate a number of mobile teen clinics within schools, as well as vaccine bus clinics at local schools. As of September the 12th, more than 14,000 doses were administered at one of these clinics. We are also hosting additional clinics at local private schools and schools in the French boards. We continue to work with the boards to set up additional clinic dates and locations. And finally, planning is also underway for additional phases of the vaccine rollout, including when vaccines are approved for children under the age of 12. And with that, that's the end of my remarks. Thank you.
Thank you. Councillor Galloway?
Thank you, Madam Chair. I have a question, Dr. Wang, but before I ask the question, I do want to take the opportunity to thank Deputy Chief Helton for the great work that she's done. Add my kudos to that and to the Vaccine Distribution Task Force generally. When we started off on the vaccine path a number of months ago, we got off to a bit of a slow start because the province seemed to short us for some reason, but we've more than caught up and now we're above average in terms of provincial numbers and our vaccination rates provincially and certainly compared to some of our neighboring public health units. So congratulations to the team. I think we've particularly done well in our outreach programs and our pop-ups and getting into the neighborhoods and dealing with groups of individuals that may have been hard to access, and I think we've done a particularly good job in that regard. And so kudos to all involved, but particularly to Shirley on this particular occasion. The question to Dr. Wang is: the boosters are now starting to be administered, and in fact, my mother gets hers tomorrow. So the question is, are we following basically the same order as we did on firsts and seconds, that it will go to congregate settings first and then those eligible in the general population above the age threshold will come next, or will it be done differently than the firsts?
Thanks for the question, Councillor Galloway. So the eligibility for the third dose is somewhat different than how the prioritization of access to vaccines rolled out. So currently, there is a very select number of health conditions, often associated with severe immune compromise, that are recommended to have a third dose to complete their series. So for these people with very specific health conditions, usually needing to be followed by a specialist, these people are now recommended to have a third dose to complete their series. So their series would no longer be a 2-dose series, it'd be a 3-dose series. And that's a list that the province recently updated. And at this time, we don't have an indication that they would expand that list further. But they're continuing to monitor the evidence and awaiting, any further recommendations from expert bodies like NACI. There's also another group of people that are also currently being offered the third dose. And those are those who live in long-term care homes and higher risk retirement homes. So in those cases, that's a group for which the ministry feels that there may be some waning immunity, and for whom they want to offer a third dose as a booster shot. Now, there are no other groups at this time for whom a third dose has been recommended to be eligible. So, for example, those that are in older age groups but live in the community. So at this time, those with those very specific medical conditions or who live in long-term care homes or higher risk retirement homes are the only ones for whom a third dose is being offered. But the province continues to monitor the evidence. And one of the pieces of evidence, that is important at this time is the fact that for the general population, so outside of these groups, what the evidence is showing is that there continues to be strong protection with 2 doses, which will remain the usual series now for most of the population. But they're going to continue to monitor as studies continue to come in.
Okay, thanks very much, Dr. Wang.
Thank you, Councillor Galloway. And thank you, Dr. Wang. We will now call on Vicky Murray for a vaccine rollout update. Welcome, Vicky.
Thank you. Thank you very much, Chair Redmond, and good evening to the members and guests of the Board of Health. I'm glad to join you this evening to be able to give an update on our regional vaccine rollout. It's been a pleasure for me to be able to work with the Region of Waterloo Vaccine Task Force on this rollout. We've accomplished a lot already, and we're going to continue to keep working and strive towards greater vaccination rates for our community. As we know, this provides the protection we all need against COVID and the Delta variant. I have to say, too, it has been a joy for me to work with Deputy Chief Hilton. She has provided wisdom and leadership for our vaccine rollout, and I have felt blessed to have the opportunity to learn and grow working with her. As Deputy Chief Hilton has always provided a positive, supportive, and collaborative presence to our vaccine work. I have to wish her all the best as she leaves the vaccine task force. We will miss you, but thank you for all you've done. As of today at 1:30 p.m., our regional vaccine dashboard shows that the Region of Waterloo has vaccinated 88.23% of eligible 12-plus residents with first dose, and 82.33% of eligible 12-plus residents are fully vaccinated. The vaccine rollout in Waterloo Region continues along at a steady pace. We continue to do approximately 1,000 doses a day in Waterloo Region. At the regional clinics, which are Boardwalk and Pine Bush, along with primary care offices and community pharmacy. We're thankful for such supportive partners in this vaccine rollout, and I would like to note that we have moved to a model where generally 50% of our daily doses are now being administered by community pharmacy. Our local pharmacists are a great resource and can provide education and information to support anyone looking for additional information in order to make a decision to get the vaccine. Over the past couple weeks, the percent of first doses we are delivering each day has increased and is now around 50% most days. In particular, the vaccine bus is very successful at providing an opportunity for first doses. And last week, our main bus provided 70% first doses of all the doses they gave. We continue to focus our efforts on outreach and making it easier for people to get vaccinated. Our buses continue to be successful, providing an easy opportunity. But there's ongoing work with a lot of community partners, school boards, churches, local businesses, our post-secondary education institutions. We've been working with the shelter systems and the hospitals on expanding outreach. Support for people who are support for people who are on the recently increased third dose eligibility list is in place, and we are giving doses to those people. Our home-based vaccination program has been successful, and numbers have decreased from the 100 a week that we were seeing when it started. Planning for vaccination of children ages 5 to 11 years old is ongoing. We will leverage the processes already in place, combining that with the lessons learned from the clinic survey data and engagement recommendations to provide accessible options for family vaccination. Key partners such as primary care and community pharmacy are collaborating with us on a variety of options for consideration, which include family vaccine clinic days at our Boardwalk and Pine Bush fixed clinics, after school clinics. We're looking at drive-through options. And of course, we'll have mobile clinics at locations to provide increased access and pharmacy and primary care options. As planning progresses and more notification on vaccine approval for this age group becomes available, we will adjust and communicate our plans more broadly. We'll be ready to tackle vaccination of this important age group when the approval process is in place. COVID vaccine work continues. Our drive is to provide safe, easy, supportive environments for our community to get vaccinated. We welcome questions, and we have knowledgeable professionals available to answer questions and provide up-to-date information on site at our clinics. Thank you for your time today.
Thank you very much, Vicki. I don't see any questions. I'm wondering, Councillor Vrvanovich.
Thanks, Chair Redmond, and thanks, Ms. Murray, to you and Deputy Chief Hilton and everyone for the ongoing great work that you've been doing. I too want to add my thanks to Deputy Hilton in particular. I know from the time she was superintendent at Central Division and to her work through here, she really has exemplified all the great things one might expect from someone in the policing profession, and it was great to see her play this leadership role over the past number of months. Just a couple quick things. Thanks for having the vaccine bus out at Ribfest last Sunday. I don't know what the uptake was. I know the Stanley Park Community Association has a large event this Saturday, and they're expecting upwards of 1,000 people. So it may be worthwhile taking a look at that. Obviously, there's Oktoberfest stuff starting to come up over the next couple of weeks and so on. The one thing I wanted to touch on, and it may not be you, but you can maybe pass it on to the comms team. Part of the language, I think, was that, with some of the changes was that we're going into caretaker mode or something along those, basically suggesting that we're ramping things down. And I'm just not sure how much, it's probably not the message we want to get out there, because I know your team is working so hard to get that extra, 12, 13% doing, obviously coming out and getting vaccinated. So I'm just wondering if we might be able to work on that messaging a little bit from
Vicky,
a comms perspective.
Sorry, Vicky, did you want to respond?
Yeah, no, thank you very much for that. We did have a great output at RibFest, and it was an event that the bus really enjoyed going to. And I appreciate hearing about Stanley Park. I'll definitely feed that back to the bus team. I appreciate your feedback on the language in that media release. It's something that we always struggle with because terminology can reflect how people see the vaccine push. It is, I've said this before, right? We have been very effective. Our numbers are looking great, but we're not taking our foot off the pedal. That said, we're also not in the phase where we're opening new clinics every day, right? And so how do you, adequately, express that in a short memo is always a challenge. But I do take your point, and we'll definitely consider that, because work is not stopping. We're doing a lot of outreach. To be honest, I have 2 or 3 new ideas today that I'm going to take back to the team. So we will always keep working, and we will always keep pushing ahead on this.
Wonderful. And, no doubt there's some media listening today, and that I think is really the important message for them to take away to share with the community is we continue to stay ready and able, and until every person has a jab in their arm, we won't rest.
Exactly. Thank you.
Thank you. We refer to it as maintenance mode. So we're not ceasing operations. The work of the task force will continue. And again, thank you to Vicky Murray for continuing on her important role. Councillor Foxton.
Thank you, and through the chair. First, Vicky, a wonderful job with the mobile bus going around, and the number you're keeping vaccinated, because we actually thought we had hit a wall. Deputy Hilton, I thought you did an amazing, and you did an amazing job. So does this mean you're up for the 2-person challenge now that you have more time? I've been working out.
Thank you for that. I see no other councillors raising their hand. I'm going to just look to Mr. Lochner to see if you would like to add a couple of comments.
Sure, I would. Thank you, Chair Redmond. Some of you have heard me say this privately, but I think I'll say this publicly. Last fall, I remember betting that we would not have a vaccine before 2021. And as all of you know now, I was wrong. And when vaccines suddenly landed on us at the end of next year, or at the end of last year, I remember saying to Chair Redmond, what are we going to do? And Dr. Wang as well, how are we going to manage this? When Chair Redmond appointed Deputy Chief Hilton to lead the task force, I remember feeling many emotions, and the biggest one was my stress turning to relief. Mm-hmm. And then that quickly turned into feelings of hope. I know, Shirley, that you remember those first days where this was liquid gold. Mm-hmm. And police presence bringing the vaccine into Grand River Hospital, very secretive. We could not tell people where it was. Boy, have we come a long way. I knew you were the right person from a logistics and emergency management perspective, but over the last 11 months, I've learned quickly that Deputy Chief Hilton was also the right leader for many other reasons. Your approach, Shirley, to collaboration, to transparency, to difficult decision-making, and always doing what's best for residents has been, set the bar very high. I've learned a lot from you. You have helped the task force tremendously, and I know those of us who have sat in those meetings saying what's the right decision here, and there were some excruciating decisions. Your leadership helped us create one of the best rollouts in Ontario. So it's been an honor to work alongside you, learn from you, and I can't thank you enough as you go back to your other job, which I know is equally challenging. But again, I take heart that you always are focused on doing what's right for the 630,000 residents of this region. So thanks very much, Shirley.
And Councillor Shantz, are you clapping or would you like to make a comment? Oh, you're clapping, okay. I would just have to say that we really imposed on Shirley's good nature because she does not like being made a fuss over. And when we talked about how we would, and this, you know, some people say, is this a marathon? I would tell you it's a relay. And from the very beginning, Deputy Chief Hilton and Vicky Murray have been part of this. And I know that there have been task force members that did it off the side of their desk or sort of rearranged their lives. I mean, I think of Jen Davis, too, who is with Waterloo Regional Police, got a promotion and just didn't have time in your schedule for this. And Vicky, again, stepped up. So we're just handing the baton on. And we still, to Councillor Vanovich's point, we still have that last mile or last kilometer if we want to be a little bit more Canadian about it. So we know that there's work to do. And we know that we have great people continuing to keep their foot on the pedal, as Vicky would say. But Shirley, we really did want to take an opportunity for you and many other team members who will be going back to their regular roles. Thank you very much for making this a much safer community and really a vaccine task force rollout that I would say is second to none. And I wouldn't pretend for a minute to be objective about that, but that would be my assessment. So Shirley, thank you very much. Wish you all the best. And I would now entertain a motion to adjourn. Moved by Councillor Armstrong, seconded by Councillor Kiefer. Please use your icons to vote yes or no. Thank you, colleagues. We will begin council at 7 p.m. And you can...
Thanks, Shirley.